Identification and effects of marijuana consumption. Marijuana side effects, www.drugs.com. What are the short-term side effects of marijuana use? Side effects of marijuana use will be variable from persons to persons depending upon strength and amount of marijuana used and if the user is occasionally or chronically exposed to THC. The short-term effects of marijuana use include problems with memory and learning, distorted perception, sight, sounds, time, and touch, difficulty in thinking and problem solving, loss of coordination and motor skills, increased heart rate, anxiety, bloodshot eyes, and dry mouth. Reaction times may be impaired while driving. Panic attacks, paranoia, and psychosis may occur acutely and be more common in psychiatric patients. For chronic users, the impact on memory and learning can last for days or weeks after its acute effects wear off. Marijuana may be cut on the street with more dangerous substances that may lead to more serious side effects. THC in marijuana is strongly absorbed by fatty tissues in various organs. Generally, traces of THC can be detected by standard urine testing methods several days after a smoking session. In heavy chronic users, traces can sometimes be detected for weeks after they have stopped using marijuana.
What are the long-term side effects of marijuana use? People who smoke marijuana often have the same respiratory problems as cigarette smokers. These individuals may have daily cough and phlegm, symptoms of chronic bronchitis, and more frequent chest colds. They are also at greater risk of getting lung infections like pneumonia. Marijuana contains some of the same and sometimes even more of the cancer-causing chemicals found in cigarette smoke. A study from 2009 suggests that regular and long-term use of marijuana may increase the risk for testicular cancer. When people smoke marijuana for years, they can suffer negative consequences. For example, because marijuana affects brain function, the ability to do complex tasks could be compromised, as well as the pursuit of academic, athletic, or other life goals that require you to be 100% focused and alert. Long-term abuse of marijuana may lead to addiction. Marijuana also may affect mental health. Studies show that early use may increase the risk of developing psychosis, a severe mental disorder in which there is a loss of contact with reality, including false ideas about what is happening, delusions, and seeing or hearing things that aren't there, hallucinations, particularly if you carry a genetic vulnerability to the disease. Also, rates of marijuana use are often higher in people with symptoms of depression or anxiety.
Effects of marijuana on other organs. Effects on the heart. Shortly after smoking marijuana, the heart rate increases drastically and may remain elevated for up to 3 hours. This effect may be enhanced if other drugs are taken with marijuana. One study has suggested that the risk of heart attack may increase by up to 4.8-fold in the first hour after smoking marijuana. The effect may be due to the increased heart rate as well as altered heart rhythms. The risk of heart attack may be greater in those with specific risk factors, such as patients with high blood pressure, heart arrhythmia, or other cardiac disease. Effects on the lungs. After smoking marijuana, the bronchial passages relaxes and becomes enlarged, and the blood vessels in the eyes expand, making the eyes look red. Studies have shown that marijuana smoke contains 50 to 70% more carcinogenic hydrocarbons than tobacco smoke and is an irritant to the lungs. Marijuana users tend to inhale more deeply and hold their breath longer than tobacco smokers do, which further increases the lungs' exposure to carcinogenic smoke. Marijuana smokers can have many of the same respiratory problems as tobacco smokers, such as daily cough and phlegm production, more acute and frequent chest illness, and a heightened risk of lung infections. A case-control study from 2006 found no links between marijuana use and lung cancer, but no evidence-based consensus has been definitively made on the absolute risk of lung cancer with marijuana use.
Effects of heavy marijuana use on social behavior. Heavy marijuana abuse may show low achievement in important life measures, including mental health and physical health and career. Marijuana affects memory, judgment, and perception. Learning and attention skills are impaired among people who use it heavily. Longitudinal research on marijuana use among young people below college age indicates those who use marijuana have lower achievement than the non-users. More acceptance of deviant behavior, more delinquent behavior and aggression, greater rebelliousness, poor relationships with parents, and more associations with delinquent and drug-using friends. Smoking marijuana can make driving dangerous. The cerebellum is a section of our brain that controls balance and coordination. When THC affects the cerebellum's function, it can cause disaster on the road. Research shows that drivers have slower reaction times, impaired judgment, and problems responding to signals and sounds of driving while under the influence of THC.
Addictive potential. A drug is addicting if it causes compulsive, uncontrollable drug craving, seeking, and use, even in the face of negative health and social consequences. Research suggests that roughly 9% of users become addicted to marijuana, with higher rates if the user starts at a young age, 17%, and in those who use marijuana daily, 25 to 50%. While not everyone who uses marijuana becomes addicted, when a user begins to seek out and take the drug compulsively, that person is said to be dependent or addicted to the drug. Long-term users who try to quit could experience withdrawal symptoms, such as sleeplessness, irritability, anxiety, decreased appetite, and drug craving. Withdrawal symptoms usually begin about a day after the person stops using marijuana, peaks in 2 to 3 days, and may take about 1 to 2 weeks to subside. Some heavy users develop a tolerance to marijuana, meaning that the user needs larger doses to get the same desired results that he or she used to get from smaller amounts.
Immediate signs of weed use. www.narcanon.org. The most immediate signs of smoking weed are dilation of the blood vessels in the eyes, making them bloodshot, increased heart rate, increased appetite, and memory impairment, along with difficulty paying attention or solving problems. When monitoring for symptoms of weed use, there may be reactions of anxiety, fear, or panic, especially if they are new to the drug or taking it in an unsettling location. Hallucinations, paranoia, and delusional behavior can be symptoms of weed use that is very potent or consumption of a large amount. But the real reason people abuse a drug may be for the euphoria that may last 3 to 6 hours. Red bloodshot eyes, laughter and glee when it is not warranted, euphoria, strongly increased appetite for snack foods or sweets, foggy slow memory, artificially increased tendency to chatter or be sociable, lowered inhibitions, impaired judgment, dizziness, sedation, slow movement, lethargy, lack of activity.
Marijuana handlers, key points. Side effects of marijuana use will be variable from person to person, depending upon strength and amount of marijuana used, and if the user is occasionally or chronically exposed to THC.
The short-term effects of marijuana use include problems with memory and learning, distorted perception, sight, sounds, time, touch, difficulty in thinking and problem solving, loss of coordination and motor skills, increased heart rate, anxiety, bloodshot eyes, dry mouth.
People who smoke marijuana often have the same respiratory problems as cigarette smokers. These individuals may have daily cough and phlegm, symptoms of chronic bronchitis, and more frequent chest colds.
Research suggests that roughly 9% of users become addicted to marijuana, with higher rates if the user starts at a young age, 17%, and in those who use marijuana daily, 25 to 50%.
The most immediate signs of smoking weed are dilation of the blood vessels in the eyes, making them bloodshot, increased heart rate, increased appetite, and memory impairment, along with difficulty paying attention or problem solving.